today we're going to focus on treatments that really can take you years younger. Okay, so the skincare products, the Glow Peel, it can give you that glow, it can brighten you, it can make your skin look more fresh, refreshed. But the treatments that we're going to focus on today, which is the PiXel8-RF microneedling, the RHA and hyaluronic acid filler treatments, and the Jeuveau treatments, are treatments that you can still do so that you can look years younger. You're talking about 5 to 10 years younger, addressing actual wrinkles, real tightening, lifting with these treatments. So if you're interested in that, stick around. So I'm going to introduce you now to our patient, Virginia. I'm going to move here. Here she is. Hi, Virginia.
Hi.
How are you?
I'm fine, thank you.
Okay. All right. So we're going to bring this down a little bit. Virginia, tell us, I know you've been a patient of ours for how long?
Since 2013.
Wow.
Yeah.
Why do you keep coming back?
Because I love it and I'm very loyal.
Oh, good. Good, good. And we love taking care of Virginia. And, you know, we all have been through a lot this last 2 years. And so we want to just help ourselves feel better, feel more confident by taking care of our skin. So what you see on Virginia's face, if you can just come close up. So yeah, go close up, is the CO2 lift mask. And again, this is the professional mask that you can buy here, but you can use at home. And Virginia, we applied it on Virginia's skin after we applied the numbing. And what this does is it preps the skin for any of the amazing treatments that we do. Virginia is going to be our PiXel8-RF microneedling demo patient. And you can see that the CO2 lift, once you apply it, it goes on as a gel. It comes off like a sheet. See? And Virginia's a little red. Virginia, we know her. She gets a little red from the numbing. So you see that little bit of redness there, and that's normal, not a problem. And you can see this whitish film that's there, and that's the numbing cream. So by applying the CO2 lift mask to prep the skin, it oxygenates the skin, it helps the skin be more moisturized, and it also optimally allows the numbing cream to, you know, kind of occlude it so that it works better. So it's doing so much. So we really encourage our patients to do the CO2 lift mask while they're here, while they're numbing. And Virginia, how's the experience with the mask? Do you like it when they applied it?
Yeah, I love it.
It's very relaxing.
Yeah.
It's very soothing. And so, you know, when you're relaxed and you feel like you're being taken care of, your results will be better. And overall, part of, you know, our healing process is how we feel. And so that adds to the end result. So what Virginia's going to do is she's going to wash off the numbing. We'll prep her skin for the PiXel8. And then what we're going to do now is we're going to show you all of the information on RHA fillers. And this is the latest technology in hyaluronic acid fillers. And sorry, it's crooked. Hyaluronic acid fillers. And okay, Virginia, we'll see you in a bit. Okay. All right. So RHA, I'm going to explain in this video, and you guys will get to see a live demo, and you'll see the power of fillers. As we all age, we lose volume, and part of why we don't look the same, part of why you see some lines, some jowling, some wrinkles, is because of loss of volume. And so fillers are an important component if you want to instantly look years younger, and it restores the structural support that we lose. So watch this video, and then when this finishes, we'll come back and we'll start on the PiXel8-RF microneedling demo, okay? So if you can hear me, I use a cannula, and that's that metal tube that's inserted underneath the skin through one little opening. And you can see that I'm filling her cheeks. It's very, very crucial when you're doing or you're having fillers done that whoever is doing it really know what they're doing. There are a lot of potential complications if it's done wrong. Hyaluronic acid fillers, the nice thing about it is that if it is done wrong, you don't like where it's placed, there's a big lump or, just doesn't look good, you can get them dissolved. There's an enzyme called hyaluronidase, and I'm proud to say that we've never had to use hyaluronidase on any patient because our goal, of course, is whenever we do this, we get great results that you love. And so it's going in under the skin. I'm delivering the hyaluronic acid filler very, very slowly, sort of like little tiny droplets all over, because with volume loss, it's not just one area that loses a lot of volume. It's kind of a global area that loses volume. And you can already see how much better her acne scars look. And when she sits up later and you compare it with the treated side will look lifted, because here you go. You can kind of see she's looking at herself and she's saying she really likes it. There you go. And you can see that when she smiles, the lower part of her face and that nasolabial fold, that laugh line, is minimized. And look at that. Look at her face. The right side is lifted. The jawline is lifted. That heaviness of the lower cheek has been improved. And that's just by putting a little bit of filler in her cheek. So the results that you get from fillers is really dependent on the volume, the number of syringes, and the number of, cc's that is used. So for most patients, if you've lost volume, the more volume we have, the better the correction. So this is actually the second syringe on this side that we're using on the patient. Again, going through the little tiny hole. So you can see that I'm basically filling up her entire cheek, just using that one little opening with the cannula. So now I'm turning it and I'm filling that laugh line, the corners of the mouth, the middle part of the cheek, the underneath. See, now I'm turning again. I'm filling that deeper acne scar on the upper part of her cheeks by her cheekbone. You can see where the tip of, I'm pointing to the tip of the cannula. So again, this requires incredible mastery, incredible experience. When people watch this, they're like, oh, it's easy, you just inject fillers, but that is not the case. To get amazing results, you really have to know what you're doing. You have to plan in your head what you need to do, because you're given a certain number of syringes. So, if a patient, with her, we're going to use a total of 4 syringes. So this is the second syringe on this side. You have to make sure that by the time you finish all the syringes, the patient looks symmetric, even, and you have addressed their concerns. And for this patient, she wants some lifting, she wants some plumping, she wants to get her cheekbones back, she wants that apple, cheeks when she smiles, and she wants improvement in her jawline, in her acne scars and jawline. So you can take a look. She's looking at herself in the mirror. Compare it with that side that's not done. So we treated that right side, and look at her when she smiles. Smile when she smiles. It's amazing how when it's done right, we are adding volume, but her face looks slimmer. And that is because as we age and as we lose volume on the upper part of the cheek, the lower cheek sags, and volume and skin, basically collects in the lower face. So now you become bottom heavy, and that makes you look tired, that makes you look older. So again, this is finishing out that second syringe. So most patients really require about 4 syringes of a filler. Unless you're really, really young, and unless we're like treating just a very, very localized area. But if you're doing a global improvement like this patient, where we're trying to recreate, look at how happy she is. She's smiling. It's instant. It's like magic. And it's so visible. Her left side that's not treated looks a lot heavier, looks more, kind of droopy and saggy. I think that's it.
Someone was asking if there's pain.
Is there pain involved? Where there's a lot less. Yeah, you can stop the video. There's a lot less pain than if you get me. Hello, welcome back. So the question is there pain? Obviously, there's injections involved, but when we use this cannula technique that you saw, that requires a lot less poking. But there's still a little bit of a weird feeling because the cannula, that little tiny thin metal tube, is under the skin. We numb the skin with our very strong topical numbing cream. But if you're still nervous about it, we can have you use the nitrous gas, which you'll see. We're going to start the PiXel8 treatment now.
They asked how long does it last?
How long does it last? Depending on the filler, they can last for 15, 16 months. Most fillers, I would say definitely a year, as long as you don't lose weight. And as long as, some patients, if you work out a lot or you are very, very slim and, tone, and you really don't have a lot of volume in your face to begin with, you can metabolize the filler fast. So that's kind of a range between 12 to 16 months for patients, depending on the filler. Any other questions, please? Feel free to ask questions. Sorry again about that technical difficulty, but I hope that you guys got a sense of how the fillers work. The cool thing about fillers and the holidays and any important event is that the results are instant. And you can get your fillers done, today, and you walk out looking years younger. You walk out lifted, you walk out with less wrinkles, you walk out with less acne scars, and you can be instantly happy. And that's really great about the fillers. And you may have a little bit of swelling. Some patients bruise a little bit, but it's not anything that usually is not coverable with makeup. So let's move on. Any other questions, please? Comments?
We're good here.
Okay. All right. So now Rick has already started the PiXel8. This is RF microneedling, and we'll show you the tip.
One question. How long will those stay, the fillers?
Yeah, I already answered that question. Yeah. And so, how are you doing? Good. So our patient, I'm gonna just lower this.
You can talk about the machine first.
Yeah. So the RF microneedling is the device is working through, I'm going to show you. I don't know if you can see. There's the tip here. There is
like a stapler.
Yeah. There are needles. So this one has 49 little needles that insert in your skin. And as it's doing that, it's delivering radio frequency. And radio frequency is one of the most effective types of energy to try to heat underneath the skin. And what that does in the end result is that we are going to build collagen. And when you build collagen, the end result that you get will be skin is tighter. If you have wrinkles, the wrinkles are smoother. If you have crepey skin, it becomes tighter, smoother. If you have acne scars, it also fills in acne scars. So you can see here, turn this way. I'm gonna just try to move this.
I'll do the side too. So
yeah,
I just want to.
And she is now using the Pronox nitrous gas anesthesia.
So the cool thing with this is that you can select how deep you want the needles to go in. So for cheeks, it's a lot of fat pad. So we can go like 2 millimeters, 2.5. If you're really have a lot of fat in your cheek, we can even go to 3 millimeters. And then the thinner ones, maybe like around the eyes, around the the nose, the mouth. We can go a little bit not as deep.
Yeah. Where PiXel8 really is amazing is also off the face. So the neck, I've had 2 of these treatments, 2 treatments 1 month apart before my 50th birthday, and I see a huge improvement in my neck. And so, if you're looking at your neck and you're like, starting to look saggy, it has a lot of creepiness, has wrinkles, you have tech neck as well, combined with Jeuveau, and we'll demonstrate Jeuveau for the neck. It's amazing. And also the downtime, because a lot of our patients, you guys know us about for our time machine procedure. The time machine procedure has about 2 to 3 days worth of redness, swelling. We're a little bit puffy because we inject platelet-rich plasma. But with PiXel8, you're immediately after, you have some redness and swelling, but the next day you're totally fine. Your skin is not red anymore, not swollen. So this is something that we really didn't have as far as our armamentarium or what we can offer patients. It was either you come in and you have your time machine procedure, or you have something with no downtime like the venous freeze. But now we have something that really offers incredible tightening, wrinkle reduction, plumping of the skin, improvement of skin texture, pores, scars, and really almost no downtime. And you have questions there, Lise?
Yeah, so how's the pain? Is it painless?
Okay, so Virginia, tell us, they're asking, take this off and then we'll ask Virginia. Virginia, how's the pain?
Not bad. Like
3. Close.
3, 0 to 10. It's 3.
Three,
You
yeah.
said 3.
3 out of 10?
Yeah.
3.
Yeah. So you definitely
Just like
feel
a
it.
pinch.
Yeah.
Yeah.
And you can see if you come close to her skin, there's pinpoint bleeding because these needles will really go in the skin, right? And as it's in the skin, it delivers radio frequency, and that's what's causing the redness, a little bit of swelling. Some patients swell more than others, and it's fine even if you look red and swollen. The next day, that's gone, and so you can go to work, and you can be presentable. You can go on your Zoom meetings, and you're totally fine. Keep going.
Yeah, and this is really the cutting edge of aesthetic technology now. This is really it.
We're really excited about
Yeah.
this, and so what we're doing with PiXel8 as well is that we are combining it with our time machine procedure. You can look this way, yeah. With our time machine procedure, so we can do our fractional radio frequency resurfacing or our laser skin resurfacing with Fraxel, and then we add on the PiXel8-RF microneedling skin tightening, and then we can absolutely combine it with microneedling and platelet-rich plasma or platelet-rich fibrin matrix. So all of that can be done on the same day for incredible global improvement and results. And you can also get the PiXel8 done and the time machine procedure done and still get your fillers done on the same day. Okay, all right.
We get introduced a lot of technologies and a lot of machines. This is the first one in probably in a couple of years that we were really excited about, just because
Yeah.
we're now really able to deliver energy inside the skin, where before it was all outside the skin. Okay.
Okay, so we'll do multiple passes, but in the interest of time, what we're gonna do is we're gonna do the Jeuveau You can do it. I'm gonna switch. Okay. All right. Okay, guys. Let us know if you have any questions. Yeah, we'll just use that chair because Virginia, we'll give you a little break. Okay. Actually, you can keep working on her, and then I can.
Yeah.
Okay. All right. So we're gonna just make a little bit of a move here, and again, stick around because you have to be present to win the raffle. Okay. And any other questions? So again, we demonstrated of these treatments, which is the what?
That's for the 11 lines.
The 11 lines, the Jeuveau is the best for the 11 lines because you make those 11 lines because of these muscles. Okay, so absolutely, you can get the Pixel done, you can get Time Machine, you can get fillers, and also get Jeuveau because they all work on different things. All right, so I get them done. So I've had the Time Machine procedure, I've had the Pixel8 skin tightening, I've had Jeuveau because I keep up with the collagen building treatments like the Time Machine procedure and Pixel8. I really rely less on hyaluronic acid fillers, but if you've lost a lot of weight or if you've, most patients after the age of 40, there is some volume loss, you may need some fillers if you really want to instantly look better right away. And it really addresses that loss of support that happens as we all age. Okay. All right. Hello. All right. So.
Is it comfortable?
Yeah.
All right.
Or in school.
Yeah.
All right. So I'm gonna just wear my mask.
I'm gonna keep going.
Yeah, keep going. Okay, so when I do treatments, I still wear my mask, I still wear a shield, and so hopefully you guys can you guys still understand me?
And then how long does Jeuveau last?
How long does Jeuveau last? So we like to use smaller units, and the lower the units, the more natural the result. But so I would say if you don't like to see your lines come back, and live with it for like a month or two, then you need to come in maybe 3 times a year. If you don't, if you like me, I probably get it done 3 times a year. But some patients can get away with 2 times a year, but you will have maybe a couple of months where the lines are back. And if you're preventing and treating those 11s, it's very important that you don't allow the muscles to recover because then you're going to crease, and then they'll come back again. Okay, so let's evaluate our patient. Thanks for coming in. No, you can keep your mask on because we're not concentrate the upper face. So your 11s, give us a big frown. Big frown. And you just came in and had treatments done, right?
A couple months ago.
Couple months ago, and we treated these. So it's a little weak right now, but you can tell that this was probably a problem area before we started treating.
Yes.
And what do you think? Has it gotten better?
Lots better. Oh my gosh, I love it. Yes.
And was that the first time that you had treatment for the 11s?
No, I had it probably 2 times more.
Okay. And would you recommend it?
Absolutely.
Right?
I get so excited when I come here.
Yay! And she has some mom, so okay. All right, and raise your eyebrows up. Okay, so you can come closer. These are also very common lines that we treat with Jeuveau or Botox. So again, Jeuveau is a Botox alternative. It's botulinum toxin, and so it's really for your purposes. Yeah, we use the same needles, use the same dilution. So the experience is the same, but patients are actually, I'd say 90% of patients who love Botox, who've tried Jeuveau, are sticking with Jeuveau. And it also is so much more affordable to patients. So it's like, if it works, it's affordable. We love it as well. I have Jeuveau here. I've been getting it for almost 2 years. I haven't had Botox for almost 2 years, but again, it works the same. So we're going to treat her forehead and smile big. So turn to your side or just show. So these lines are what we call crow's feet. I don't know why they call them that, but these lines are made because there's the circular muscle around the eye that contracts. And so if we relax that, you're not able to contract and crease the skin. And within a few days, Jeuveau works quicker. The onset of effect is quicker than Botox. It's going to be like magic. So for your holiday pictures, your reunions, your get-togethers, if you really want to look years younger and you have the 11s, the forehead lines and crow's feet, this is a must. You must come in and get Jeuveau. And right now we have $80 off for first-time Jeuveau patients. Okay, so we're not going to do a lot here, because she's still weak there. So we can customize the amount of Jeuveau that we use. The other area that we use Jeuveau, take your mask off and let me just see if we, okay. And purse your lips and come close. And you can kind of see some of these vertical lines around the mouth. So just like around the eyes, there's a circular muscle around the mouth that causes this creasing. So I'm going to add just a little bit here. I don't know, have you ever had that done?
Mm.
Okay, tiny bit, very, very small dose, because obviously we don't want to totally remove the movement, because you need to speak, you need to smile. So just a slight amount. The other thing that we can do is what's called the lip flip. So smile big. So for those who want a little bit more of show of the lip, which most women like, a little bit of the Jeuveau here will also cause you to have a little bit of the lip flip. The other area that we can use it is frown for me, like frown, like yes, there you go, perfect movement. Come in closer, and you can take this. Yeah. Let's see.
You'll get it.
Yeah. Sorry, I can't see. Yes. Yeah, like frown. Yeah, saddy face. So there are these muscles that pull down, and if you're finding that you're looking more sad, or your corners of your mouth are turning down, we can treat that. We can also treat the chin. If you have a lot of what we call chinulite, the texture of the chin is no longer smooth, we can treat that a little bit. The other area we're going to treat, and is really wonderful for to be treated with Jeuveau, is the neck. So these bands here, so these bands here and the lines, there is a muscle called the platysma, and if we relax that, it doesn't contract and doesn't crease the skin, same as the forehead. And so those lines and the bands really, really relax and look a lot less noticeable. So, okay, so, all right, let's go. So these are tiny needles that we use. These are insulin syringes. And so, we really try so that we make our patients feel as comfortable as possible. So, okay, maybe this side. No, I'm going to demonstrate.
Where are you going to be?
Right here. Frown for me? No. Frown? No. And how much we put in really depends. Like I said, this area is weak right now. The other area that we can treat is here. So I'm just going to go a little faster now. Reach eyebrows up. Jeuveau is also really nice for forehead lines because it's very precise. We know exactly where we're going to put it. And it has less of a chance of dropping the brows compared to Botox. So that's also a big plus for Jeuveau. What was it?
Great.
Not bad? Okay, Rachel was it. Yeah, people are always scared. I don't want to go because I'm scared of needles. It's really nothing. Plucking your eyebrows hurt more. And this is very, very exciting because in a few days, the lines are just going to be so much better. Most of these lines are going to be gone. Okay, so we're now treating crow's feet. This is a home run. So when you have these lines treated, when you smile for your pictures, and especially because now we are always wearing a mask, the only thing people see is like our forehead and our eyes. So Jeuveau is even more important than ever because, you know, you don't want people to just see wrinkles. Okay. All right, and let's just do a little bit. We're going to treat now around the mouth. So again, this is literally, this one's probably going to be a little tender, okay? Yeah. This is going to do the lip flip, and it'll help with these pesky, annoying vertical lines. Make you look like you're a smoker, even if you never did, you know? So my patients hate those lines with a passion. So again, now I'm treating the chinulite, so some of the, you know, wrinkles and textural issues there. She has a little bit of a, you know, the corners of the mouth are downturned, so we're going to try to prevent these muscles from pulling down on the corners of your mouth. Very, very small doses there, okay? And then now let's do the neck. Have you ever had your neck treated? Are you excited?
Yes,
okay. This is really magic for the neck. It's the advanced treatment. And so, but definitely, if you're looking at your neck and you're like, come in. This is magic. So we're treating the platysmal bands. And you can see these are tiny little injections. And because these bands can become very prominent as we age, and they make the neck and us look a lot older. And before this technique, and you know, like a combination of treatments like PiXel8, the only way you can treat these bands is to have it surgically cut, and then they kind of sew it down. But now we can kind of cheat non-surgical way to address it. And what's exciting is that it's been shown now through studies that if you get these movements treated earlier on, you actually can prevent the bands from ever forming. So if you're younger and you don't have very prominent bands yet, you can prevent them from ever forming. And if you have the bands, if you treat them, you keep them from becoming worse. And so, you know, over time, your neck will look younger and younger. And then absolutely, you'd be an excellent candidate for the PiXel8.
Like
You're
that.
looking at that.
Yeah, I was listening about that. I'm going to do that.
Yeah, so.
Come here. Come
Take a
here.
break
I'm
from
gonna
her.
see you. You're next.
She's like, take
You're
a break
next.
from her. She's already had enough pulses.
No, that was easy. It didn't hurt at all.
What do you think? So she's all finished. So this is it. We did Jeuveau for basically all the areas that we would normally do for a patient. This is a complete rejuvenation with Jeuveau, where we treated the 11s, the forehead, the crow's feet, the lines around the mouth, the downturned lip, the chinulite, and we treated the neck bands and the neckline. So it's exciting to know that within a few days, it's going to be so much better.
I love it. Thank
Yay. All right. Thanks. Thank you so much.
Thank you.
And then Rick, I think just finished too.
Yep.
Okay, let's show the end there.
I want to say something about Jeuveau. You know, why come to us? Because you know, so you know, a lot of doctors can get Jeuveau, can get Botox. It's just like having like a paintbrush and paint, right? It is all about artistry. What you're coming for are the artists to make it look good and make it look natural. So that's really the thing. Is you can go to another place and which is why we get a lot. Which is why we get a lot of people. You know,
it's really true. You know, I teach doctors courses on how to do fillers, how to, you know, do these tightening treatments, combination protocols, treatment with Jeuveau. I actually have a course this Saturday on combination protocols, and it takes a lot of expertise to do this right. It looks easy, like if you're watching and maybe you're an injector, you're like, oh, I can do that. But there's a lot of planning, a lot of thought and consideration that goes in.
a lot of trial
And
error
there's
also.
also you need to customize the treatment for patients as well. Hey, when I wear this, my mic works better. I'm just gonna wear it. So okay, so how many passes have you done for?
So I've done one. I'm just gonna do another one, just the cheeks.
Okay, so you can see that she's definitely now more red. Yeah, and then so Rick is going to do another pass, and this redness, I swear, I promise guys, by tomorrow she won't be red anymore. And when she's done, I want to talk to Virginia, because she gets asked all the time by her friends, what are you doing to your face, right, Virginia?
Right.
Give her a break. And what do you tell your friends?
I tell my friend, if you're ready, let me know, because I said, I have a secret, but if you don't want to listen, I told them, if you don't want to listen, because sometimes they ask me, and then later on they ignore. So I just get tired of it.
So you're saying when you're ready, I'll tell you my secret.
Yeah, I'll tell you my secret. I'll take you over there.
Yes, because Virginia looks great, you know. And so, okay, so thank you, Virginia. There's going to be more. We'll do a little bit more. And Virginia is using the nitrous gas, and obviously she numbed with the numbing cream, with the CO2 lift mask. And if you're really nervous, we also can prescribe to you a sedative, but you can't drive yourself. So that's the only thing when you take a sedative. As long as somebody picks you up and drives you home, you can take a sedative for any of the PiXel8 or the time machine procedure. For Jeuveau, we don't even numb people's skin, because as you can see, it's very easy, very quick. And these are tiny, tiny needles. Okay, so I think it's time for the raffle. Is that what you're
Raffle.
motioning? Mm-hmm. All right, so again, we have, who are the winners?
So for the OCMD is Maisie S.
OCMD Macy S. Woohoo! All right, so the raffle winners, we want you to, we're going to contact you. So don't worry, we have your information when you registered, so we will contact you. Oh, and before the next raffle, let me just talk about the specials. We have amazing holiday specials that I want each and every one of you to really, really take advantage, because this is our gift to you for the holidays, okay? So our holiday specials, Jeuveau, because this is the easiest, fastest, and probably the biggest bang for your buck, you know, if you want to really look younger instantly and take care of wrinkles. So you get 15% off if you purchase 100 units of Jeuveau. You don't have to use it all in one sitting. You can save it for next time, but you get a big discount. And or you can get free 20 units of Jeuveau with purchase of any treatment series. So whether it's your Versa IPL, your Gluta, your Venus package, your PiXel8 treatment, laser hair removal, hair evolution PRP, any of those treatment series, you will get 20 units free of Jeuveau, so you can try it for your 11s, okay? And all of the Jeuveau treatments, there's an $80 off Evolus reward. So normally it's $40, but for the holidays, we here at M Beauty are offering $80 off, and that is huge. And that maybe allows you to think about treating other areas. If you've only treated your forehead or around your eyes, you may want to think about treating your neck. It's really amazing for your neck. Every single one of you, if you are 40 years old or over, you need to do the neck, okay? And then raffle winners. Oh, yes. And all the products again, OCMD, CO2 lift mask, Illumier product, Sculpt patch, and the Jan Marini duality. They are buy two, get one free. And we only do this sale for the holidays. So this is a great time to stock up.
And if they have time, they can watch the video that we did
yesterday. Yesterday we did the video, we demoed the Glow Peel. We talked about the individual products. So go to my Facebook and we'll also email you the links of the video so you can watch. And 40% off the Tensage Advanced Renewal System, which includes the stem cell cream and the stem cell eye cream. And they're all here. Ta-da! Those products there, down below. And the kits up here. Most of those, except for the BioPel Tensage, are buy two, get one free. Okay, so we'll talk more winners. Thank you all for joining us. But we have some winners to announce.
Okay, so number 2 for the Daily Defense Kit is Pasita B.
Pasita, we love Pasita. How are you? Thanks for joining us. And now you get to try the Daytime Defense from Illumier MD. And this has the ever active vitamin C, E, and peptides, and also an incredible sunscreen. Let me show you. It's really cool. Ta-da! There's the sunscreen and there's the vitamin C and E. Also, now is the best time to start thinking about IV glutathione and vitamin C. A lot of viruses out there. There's the new COVID variant. Not only is the IV glutathione and vitamin C awesome for the skin, for discoloration, for brightness, and also just the quality of the skin, but it's also amazing for your immune system and overall health and anti-aging. Okay, now the next one is either one of these, the Calming Collection or the Acne Kit from Illumier MD. And the winner is
Yasmin M.
Yasmin M. So let us know if you have more acne prone skin or if you are more sensitive and irritated. And so you get to choose which one. Okay, and we'll help you as well. All right. And finally, last but definitely not least,
Sandy C.
Sandy C, you are the winner of the 25 units of Jeuveau, our Botox alternative wrinkle treatment that you guys just watched me perform on our patients. So yay, you're gonna look so much younger for the holidays. All right, and I think that's it. Another thing is that we do offer free consultations. Please, any questions for your face, your skin, your body, your hair, we can help. We have so many incredible solutions now, more than ever, all cutting edge, all safe. Most of them I've tried on my own skin and family. Like I promised people, we will only give you treatments that we would do for our skin. Okay, so you can know that you will get great results and stay safe. And all you need to do is email us, call us. And our patient here, she's all done with the PiXel8, and
she said sometimes
she's so happy.
Sometimes she said sometimes she's with her husband, and then they think it's her sugar daddy.
Woo! Looking great. Okay. Any final questions before we say goodnight?
We're all good.
All right. So schedule your free consultation if you're a new patient. Our cosmetic consultants are awesome. And it is all under my guidance. I'll evaluate your photos, your concerns, and we will give you our recommendations. And then you get a quote on everything that we recommend.
Maybe I'll see you guys.
We have offices in San Diego, Chula Vista, East Lake, and also in Beverly Hills. And so we all hope to see you guys during the holidays, but if not, this is the best gift you can give yourself for the new year as well. Start off the new year amazing. And we'll just say a final bye to Virginia here.
No,
What do you think?
you didn't ask me how old I am.
Oh, well, let's see. Hold on. Virginia wants to reveal her age.
65.
What? Well, look at her. Say that again.
65.
65. No wonder they think your husband's your sugar daddy.
Yeah. And my mom and my husband is husband and wife.
Oh my God. I love that. All right. So thank you, Virginia.
Thank
But
you,
look at her.
Doc.
See,
Thank
it's
you,
not
Rick.
too
Yeah.
bad.
Thank you.
You've been with us for so many years.
Yeah.
And I just want people to know that when you do the right things and you're doing maintenance treatments, you really can continue to look better, right, Virginia?
Right.
And you just really reverse the aging and then stop the aging process.
Right. And I want to say something about that. Miss O, you heard about Miss O? They're asking me to go over there and give me free Botox and stuff like that. But I said no. I'm gonna stick to Dr.
Stay
Tess.
with Dr. Tess.
Yay.
Thank you, Virginia. I think, eventually people realize and then they make their choices. And we're always happy to see our patients. And we have patients who are coming in we haven't seen for many years, who've gone to different places and realized, this is the place. So thank you.
Right.
And thank you all for joining us, Rick. Thank you.
Thank
Thank you, Valerie, Val, come over here and say bye to. And if you have
Bye,
anything else you want to say, you guys call us. You'll talk to Val.
Oh, yes, please take advantage of the promotions. We do not offer get anything free like that. So take
Only
advantage.
for the holidays.
I haven't even told you yet. We had someone so excited about the buy two, get one free with CO2 lip. She bought 9.
This is the time to do
9.
it. And it's only because I turned 50 and I feel very generous. I want to really give to our patients. And it's the holidays and we all have been through so much during COVID. And now that we're able to really be out there and enjoying, celebrating, having reunions, parties, get together, I really want you guys to look and feel your best. So please contact us now, later, but do not miss these incredible
Yes.
holiday offers
Get
because they don't
in.
happen a lot.
Yes, they don't take advantage. They're incredible promotions. I encourage everyone to take advantage of it. Just give me a call. You'll probably talk to me anyways.
All right, bye guys.
guys.
Good night. And thank you to Lisa and
Thank you.
James and Rick.
It's beginning to look a lot like Christmas. All right.
Bye.
Evelyn just